Hello, everybody. Can you hear me? Awesome. And we'll get slides in a second. My name is Leong. Leong is my first name, and I work at Northwest HealthLaw Advocates. Excited to talk to you today about the Coalition for Healthcare and Language Access. As I think many of you in the room know, back in 2020, during the pandemic, DSHS stopped testing for medical interpreters, which has contributed to the situation that we find ourselves in today. About 8% of the people in Washington are of limited English proficiency. That's about 600,000 of our neighbors, community members, friends, loved ones. Unfortunately, there's been a shortage in interpreter access for a very long time. But given the additional challenges since DSHS stopped testing of medical interpreters, people noticed that this was a problem and came together to say, how do we go about solving this? And so last year, in recognition of this need, people from across sectors, people from managed care organizations, from hospitals, from community-based organizations, providers, and advocates, like those of us at NoHLA and WASCLA, came together to say, what can we do? And we would love to have any of you who are interested in coming up with solutions collaborate with us to identify what those next steps should be. So next slide. Our efforts currently consist of two major work groups, and there's a language access systems work group that's looking at the bigger picture, that's trying to think about things like funding models and service delivery, contracts, more sort of larger systemic changes. And so the goal is to really develop solutions to think about making a map of all the different funding streams that might be pulled together in light of the $15 billion state budget shortfall, and to explore community-based models. So if you're interested, Kush is actually in the room today and would be happy to connect with you and get you connected to the work group. The other work group is focused on the pathways to credentialing. As you heard from Andres, it is very challenging to figure out how to navigate the system and also to help think about how to address some of those barriers in not just an individual way. So this work group is really focused on things like certification, making suggestions for revising the current requirements in a less onerous fashion, and addressing barriers, especially for languages of lesser diffusion. So Angelina at Multicare is the person coordinating that work group. Her email is here, and I believe these slides will be shared with you after today. On the next slide, just because I have a stage, and my role is advocacy, I wanted to make sure that given the current landscape federally, that everyone in this room is aware of some resources. First, in Washington State, people do have language access rights, as I think most of us in this room know. Northwest HealthLaw Advocates has a presentation that we put together in 2022 that's English and Spanish. If you'd like to review that resource or might find that helpful, we will include a hyperlink when the slides go out. The Northwest Immigrant Rights Project, only last month, in response to all the swirl that has been kicked off from the new presidential administration, put together an advisory for nonprofit organizations and social service providers. So if you're in one of those categories in Washington State, I would encourage you to refer to that resource because NERP does great work and can help you better understand what our shifting landscape is. Nationally, there are many advocates working on these issues. Protecting Immigrant Families is a coalition of organizations nationwide that has put together a number of resources. There is a resource specifically around the executive order related to immigrants and benefits that came out in late February. The key takeaway is nothing has changed yet. The vast majority of benefits aren't available to undocumented immigrants already, thanks to a 1996 law. So the goal of that EO was really just to sow fear. We do expect that we will learn more once agencies report out. That will take at least 30 days. So Protecting Immigrant Families will share updated information as it becomes available. But right now, people who have questions should go to trusted community-based organizations for more information. And finally, the National Immigration Law Center has a number of resources that may be helpful to you or community members. There's the very sadly salient what to do if you're arrested or detained by ICE. There's also guidance for how employers can prepare for potentially interacting with ICE, and specifically healthcare provider guidance. So all of those links you can find on Google now if you're especially excited, or they will go out in the slides. And now I'll hand things over to Joana.
Thank you, Lichi. It's been a pleasure working with you and NoHLA for a good number of years. My name is Joana Ramos. I was one of the founding members, and now I'm co-chair of the Washington State Coalition for Language Access, WASCLA, which you could go to the next slide, please. This tells you a little bit about us. This group was actually started the same way as the CHeCLA group, as an informal network. And at that time, it was there was an opportunity through the U.S. Department of Justice for advocates, both legal advocates and community advocates, who were working with women who are victims of domestic violence for unmet needs outside the courtroom, and they have been supported for a number of years through the Northwest Justice Project, and that grew into WASCLA becoming, that was, I think I said that, 20 years ago, and then about almost 15 years ago, WASCLA became an organization and became a multidisciplinary in all types of service sectors. And I personally got involved. I think I said that I'm a policy advocate in health and human services, and also specialize in language access now. When during some changes in my life in the early aughts, I started working formally as a medical interpreter, and from what I saw the patients experiencing, both on the individual level and the systems level, led me to seek out like-minded people, and that's how I got involved with WASCLA. Just real quick. Okay, next slide, please. So one of the things that we decided to do, and what we are doing, has largely been unnoticed, and it's a rather I don't know if ironic is the word that I'm here talking to you this week after language access is in the headlines through the executive order that English is the official language of the U.S., and rescinding President Clinton's executive order 13166 of 2000. But I just got to say to you that it's highlighting the issue, which is really one of the reasons that we struggle is so deeply rooted in all the systemic reasons of inequities in this country, that it's been ignored, and now it's getting attention in a bad way. And it's going to not, and if you read the media, they really have not been talking about the political climate that we're living in and the correlation and what even more negative consequences could be. But the advocates are not giving up, and the laws are still in effect. So what WASCLA had decided to do, our niche, is been providing a platform, a space to talk about language justice, but that has largely really been ignored. And sometimes we have to create the table where people come together. And I'm not going to tell you that it's easy. It's really, it's hard to have a small multidisciplinary group. And some of you may know that prior to the pandemic, we had annual summits around the state. And now we are virtual. And we some of you have participated in some of our activities. And we are also increasingly are just overwhelmed with requests for help that we simply cannot meet. And next slide, please. And many of them come from the public sector agencies who expect that we're going to do all kinds of technical assistance for them. And it's good that they recognize the need, but we have to make it a priority. So one of the early things we did, we heard from communities that people don't even know that they have language access rights. And we did get a grant to do this, the translations and the materials we got, etc. And you can download these off of our website. And the one thing that's good about the I Speak cards is, well, the back has a message about healthcare because of what our funding was. The front of it can be used for any type of service, so you could just print off the front. Next slide, please. And we've done tremendous amount of advocacy in collaboration with partners, including Northwest Health Law Advocates and many others. I've done a lot of the healthcare work, but these are some examples, and we don't have time to go into them. And I can tell you a real lot also about the interpreter testing and credentialing program of DSHS. That could be a whole presentation. So I'm not going to get into that, but it's been very problematic for many years. But when the Affordable Care Act was passed and Washington was going to develop its own program, the Washington Health Plan Finder, the state had hired a consulting group to do a report to tell them what they should do. And the result was that they only needed to provide services in English and Spanish for the customer service. And this was actually brought to our, quickly brought to our attention by a large Pan-Asian serving social services group. And we had 6 weeks to mobilize and do something about that before the plan was put in concrete. And so there have been, like I said, there have been gains made, but there's lots and lots to do. And when the pandemic came, there was no plan in place, and the Department of Health asked us to write up a draft language access plan for the state because they had no mechanism to do anything. So, and so you can see, and I'm just also going to highlight, we've heard about spoken language. Washington currently no longer has any programs to train ASL interpreters to qualify for the national credential that they need to work. We used to, and we don't anymore. And there's some work in place both through a community group and through the state agency in DSHS to address this, but we don't know what's going to happen. And those are just a few. Next slide, please. One thing we think Washington really needs is a dedicated Office of Language Access. They exist in a few other states, and right now some agencies are doing things and many are not. There's no coordination. There's wasted opportunities, wasted money and efforts, and that's why they come to groups like ours, and it needs to be taken seriously. And that's what the lack of having a coordinated approach that underlies this whole situation with the credentialing of medical and social services interpreters, because there never was any plan made. And the program as it exists now was created only because of litigation in the late 1980s, which is too long, too much for now. But so that's what we really recommend. And next slide, please. And this year, we don't know. We don't know what's going to happen. And right now in our state, between the huge budget deficit and then what we see coming in the or being threatened in the federal level, particularly including the defunding potentially of the whole Medicaid program, and the vicious political climate. We don't know what's going to happen, but we need to. Our work is needed more than ever now for people to figure out some things that we can do and how we're going to push back, and none of us could do it alone. So that's why collaborative efforts like this are so important. So next slide, please. So we welcome you to get connected with us. Here's our contact info, and I'm happy to try to answer questions. Thank you.
If you don't mind just staying up here for a minute, we're going to see if there's any questions. We do have some networking time at the end, but we figured that we are so lucky to have these two very serious people here to share with us today. Joanna came all the way on the train from Seattle, so just like huge gratitude for making that trip. And I just want to go let everyone have an opportunity. If you have a question, other people might have the same question too, to have that answered in a group session if anyone has anything specific.
Hi, I'm Deirdre. I supervise the CEAS program at Opportunity Council, and I had a question about the newest Know Your Rights and what type of information people might have access to where there may be no literacy or just low literacy, where maybe even reading those cards might be hard for folks to understand.
Yeah, well, I can address that, and there's some models actually. Oh, sorry. From other states and other places of using videos, audio recordings. I could tell you about other states, but that's really important, the literacy aspect. And I know that's something we deal with all the time. And I'm thinking of something in particular right now. They say, oh, but we have translated forms. And I said, well, that's not necessarily going to help people to understand what this is about. You need to meet people where they're at. And I'd be happy to talk to you in more detail about that later. One place you can look, Massachusetts Health Department, that's not the official name of it in the state of Massachusetts. They have a lot of things like that, video, audio clips they've had on their website because they have a law requiring hospitals to provide language services, and they did this big campaign when that law went into effect so people would know about it.
Do we have any other questions?
Gosh. So, Krista, she would give you help in Washington. So one of the questions that I had, I think it's kind of related but separate. One of the things that we've been hearing from a lot of our healthcare providers is a lot of air-based refugees are canceling appointments and referring to switch to telehealth as a mode. So a lot of hospitals and providers have been thinking about shifting. So what advice would you give in terms of us thinking about language justice in terms of the telehealth sphere and kind of going back to where we were with COVID?
I have a few thoughts, but you go first.
I think the central theory of the work that we do is to center people who are the most vulnerable. And there are understandable reasons why people feel fear right now, especially if they're undocumented, but also if they're just obviously not of the dominant culture. So to the extent that telehealth appointments can be provided, that's fantastic. The other thing that may be helpful to people is while the sensitive areas executive order was rescinded by the current presidential administration, there are things that health and social service providers can do. You should designate public versus private space in advance. That's not going to quell the fear of everyone, especially since here in Whatcom County, we're less than 100 miles from the border. But I think that it is helpful to explicitly share information with communities about these are what your rights are, these are the ways that we can help you, and we're here to help you, which is not necessarily the message that communities are getting right now.
Okay. Thank you. The other things I'd say somewhat on the technical side with telehealth is there has to be quality assurance for the interpretation or in-language service that's being provided. And also, I'm not a tech person, but on the quality of the digital connections. And, this was a problem that President Biden passed, worked on about setting some standards, and it's in the ACA Section 57, the new one. And I think it was before anyhow for the 2016 version, but about the quality of transmission for using in ASL. And it's not a given, or any type of sign language, it's not a given that there's always adequate, I'm not gonna say the word, well, bandwidth, but the quality of the images. And it's just like, if you do it like from a home computer, like maybe it's not gonna work. And they have to have, some really good high technical standards. And there actually is there's a, I can't remember the exact name of it now, but I can tell you about it. There's national, regional coordinating centers for technical assistance on telehealth communications. And actually during the pandemic, we were getting really concerned about what was happening with medical appointments being switched to telehealth, and what platform, not all of the electronic platforms support, including an interpreter. Where was the place to go? And I, some of you may have attended this, but I went to the one for this region, and they didn't even know what I was talking about when I was discussing language access. And that's how we put on the first ever in this region, anyhow, a webinar on telehealth and language access in 2021. But things are changing. And the last thing I'm going to say is also to be very cautious. There's a lot of there's kind of a silo effect between the technology world and the health justice world. And we are in the era of AI, and there's companies that are saying, oh, you don't need to have interpreters. We have AI. And we've already been hearing stories in Washington about patients being handed tablets and saying, this is your interpreter. So, and we need to, and we've been left out of those spaces, and a lot of them don't know that we exist, so.
Well, thank you. Let's give a big round of applause.